Hello guys, welcome to the session. So far we have discussed about the posterior abdominal region, right? We have completed the posterior abdominal region with its nose, right? So in coming couple of sessions we'll cover the topic peritoneum, right? Peritoneum and its cavity, right? Called peritoneal cavity, right? Peritoneal cavity. Right? Okay. Let's plunge into the subject proper. Peritoneum is a large, thin serous membrane which lines the interior of the abdominopelvic cavity. Observe the word abdominopelvic, right? It lines the interior of the abdominopelvic cavity. It's made up of a tough layer of elastic tissue lined with simple squamous epithelium and forms the largest serous sac of the body. So this is the largest serous sac. Similar to the pleura and serous pericardium. I hope you have already learned about pleura and pericardium, consisting of parietal and visceral layers. So as there is parietal pleura and visceral pleura, so there is parietal peritoneum, visceral peritoneum, right? These layers are separated from each other by a potential space, right, called peritoneal cavity, which is filled with a capillary film of fluid, right? Peritoneal fluid, right? So this fluid, peritoneal fluid, lubricates these two layers of the peritoneal cavity and facilitate the movement of those parts of the abdominal viscera which are unsheathed by visceral layer. So these two layers, this peritoneal fluid, right, works as a lubricant between these two layers because these two layers are in an adhesive manner, right? So thus that adhesiveness is prevented by this fluid, and also this fluid facilitates the movement, right? The mobile parts of intra-abdominal digestive tube are completely surrounded by visceral layer of peritoneum except for a small area where it passes from the tube to the posterior abdominal wall as double layered fold called mesentery, right? So all the mobile digestive organs, right? Mobile organs are surrounded by visceral layer, right? Between the two layers of mesentery is an extraperitoneal fatty areolar tissue in which blood vessels, stem vessels, and nerves run to and fro from digestive tubes. So mesentery is a double layer of peritoneum, right? We'll see more about that in a couple of minutes. Where the two layers of visceral peritoneum meet the fascial lining of the posterior abdominal wall, they become continuous with the parietal layer of peritoneum. The normal pressure within the peritoneal cavity is 2 to 10 millimeter Hg, but this pressure is high in pregnancy and in obese individuals. Why this pressure is important is because of the compartment syndrome, right? The pressure inside the abdomen may increase after trauma, right? Because there is an accumulation of blood or fluid or any foreign body, right? So the pressure obviously will increase, to which we have to respond acutely. A result of accumulation of blood, fluid, or edema leading to an abdominal compartment syndrome. So this has to be sought out immediately. Right? That is the clinical implication. So this is the parietal peritoneum, right? And this one is the visceral peritoneum. This is the visceral peritoneum, right? I'll show you. So this is CT, coronal section. This is the peritoneum, right? See peritoneum and peritoneal cavity. See, during the development, this is the gut, right? So during the development, this is parietal peritoneum, whereas which lines the viscera is visceral peritoneum. Whereas you see, if you observe clearly, okay, this parietal peritoneum and visceral peritoneum reflect themselves, right? Okay, there is double layer of peritoneum, is called as mesentery. Actually, the digestive organs are hanged in the abdominal cavity by the mesentery. We will cover that in the coming minutes, right? I'll show you. You see, we will dissect. Okay, that will be fun, right? We'll dissect these things. So these are the multi-select. I will hide external oblique, right? And then again internal oblique. Internal oblique, I am hiding internal oblique, right? And I am hiding transverse abdominis, and I am hiding rectus abdominis, right? So the selected structure, right, the blue one appearing blue, okay, immediately below the abdominal muscles, right, is peritoneum, okay. So that one is peritoneum. So this is the peritoneum, right? Peritoneum. So it is going all the way to the diaphragm, right? Going all the way to the diaphragm, because the peritoneum also covers, it has attached to the liver. And you see, if I hide these, all the back muscles, right? I'm removing all the muscular skeletal system, right? So you see, right. So you see, the selector structure is peritoneum, right? So the kidneys, adrenal glands, and some parts of the colon, right? So this one is peritoneum, are not covered by peritoneum. They are called as retroperitoneal organs because they are behind the peritoneum, right? We have already covered this in the previous sections, right? These are the kidneys. They lie behind the peritoneum, right? So accepting those retroperitoneal organs, all the abdominal cavity contents of the abdomen are covered by peritoneum. So this is parietal peritoneum, right? I removed parietal peritoneum. So this layer which is surrounding the organs, immediate organs. For example, you see this is colon, cecum, this is ascending colon. So this is immediately above the organ is called as visceral peritoneum, right? So the visceral peritoneum, right? The visceral peritoneum surrounding the stomach, liver and all, right? So that is parietal peritoneum and visceral peritoneum, right? I'll show you. Okay. So this one in the selected structure is peritoneum. This peritoneum appears like this, right? Immediately below the muscles. So this is parietal peritoneum. We have already covered this. And this one is the coronal section, right? So this is the coronal section, right, at the level of T12. So these are the different contents of the abdomen, right? This one is liver and this one is stomach, section stomach, and this one is peritoneum. You see the peritoneum is covering, right? The peritoneum, the blue one, right? Blue one is peritoneum. All the organs are contents of the abdomen are covered by peritoneum, right? So this one is so adrenal gland. You see the cut section of adrenal gland, and you can clearly see this is retroperitoneal organ, right? You see, so this is behind peritoneum, right? And you see this is spleen. Spleen is entirely covered by peritoneum. So that is how you have to understand the peritoneum, right? Initially, the peritoneum forms a closed sac, but when it becomes invaginated by a number of abdominal viscera, it is divided into two layers, right? Outer parietal layer and inner visceral layer. The folds of peritoneum by which viscera are suspended are called as mesentery. We will see about that in a minute. Parietal peritoneum is a simple layer lining the internal surface of the abdominopelvic walls. You see, this is the dissection of the abdomen, right? See, this is the parietal peritoneum, right? Immediately below the muscles, right? And this is visceral peritoneum, and the visceral peritoneum and parietal peritoneum are reflecting on themselves, right? This area, right? So you see, this is the thin layer, right? You see, the shiny part is visceral peritoneum. Okay, all the shiny part is visceral peritoneum, right? You see the visceral peritoneum, this is parietal peritoneum. Okay, this is the reflection, right? The same peritoneum is continuous as the visceral peritoneum. Coming to the differences, the parietal peritoneum is very simple, whereas the arrangement of visceral peritoneum is complex. We'll see that. Lines of inner surface of the abdominopelvic walls, parietes, right? Just the walls. It forms, the visceral peritoneum forms mesenteries which surround intricately folded and tightly packed gut tube liver, spleen, firmly adherent to the outer surface of the viscera and cannot be stripped off. In fact, it forms part and parcel of the viscera. So that is the point you have to know by heart, because the parietal peritoneum, you can differentiate the parietal peritoneum from the abdominopelvic muscles, but you can't differentiate the visceral peritoneum from the organs because it becomes the part and parcel of organs, right? You cannot strip it off. Embryologically, it is derived from the somatopleuric layer of the lateral plate mesoderm, right? Somatopleuric layer, and this from splanchnopleuric layer, right? It is innervated by somatic nerves and therefore is sensitive to pain due to prick and cut. So somatic nerves, innervated by somatic nerves. It is innervated by autonomic nerves and therefore insensitive to pain due to prick and cut. So visceral peritoneum is insensitive to pain. In fact, all the internal organs, right? All the internal organs are not sensitive to pain, but they are sensitive to the stretch, right? Stretch, and they are sensitive to chemicals. If I cut your stomach, you won't feel pain, or if I cut your intestines, you may not feel pain. But if your intestines got stretched because of the bloating gas, right, you'll feel pain. Or if your gastric mucosa got ulcerated, and because of the ulcer, it feels pain of the acid produced there. Okay, it is sensitive to chemicals, it is sensitive to stretch reflex is there, but it may not be sensitive to pain. Okay, so that is the main difference. In the male, peritoneum is a closed serous sac. You have to remember this. But in the female, peritoneum is not a closed sac because it communicates with the exterior through the uterine tubes, uterus, and vagina. We'll see that. You see, this is a peritoneum, and this one is peritoneum, right? It is not very clear. Open and close. You see, this is the male and this is the female, right? So tubes, uterus, vagina. So the organs lies within the peritoneum is called as intraperitoneal organs. Intraperitoneal organs, whereas the organs, you already know that, retroperitoneal organs. Kidneys, suprarenal glands, and ureters are retroperitoneal organs. But some organs starts as intraperitoneal organs, but they, due to a process called zygosis, they become retroperitoneal. Pancreas accepting tail, duodenum accepting initial 2 centimeters, ascending colon, descending colon, cecum, and rectum for 2/3 only. They are all secondarily retroperitoneal organs. So they are not examples for primary retroperitoneal organs, right? And coming to the peritoneum is arranged in a different manner, especially the visceral peritoneum is arranged in a different manner, right? So they are classified Okay, because of the appearance or whatever it may be, they were named, right? They are classified like mesentery or mesocolon. Okay, mesentery, omenta, and ligaments. Ligament is not the same thing as in the musculoskeletal system. Okay, that is not the case here. Ligament is nothing but the only the peritoneal layer only, but some form of thickening, or sometimes there may not be any thickening at all, right? So just the location, depending on the location, it is called as ligament. That's it, right? Coming to the mesentery, we have already seen that. You see, this is the parietal layer. Parietal layer is coming and reflecting as visceral layer, or visceral layer is coming and reflecting as parietal layer. So this one and this one, okay, double peritoneal layers are called as mesentery, right? In fact, this acts like a stalk on whom the intestines, abdominal organs, hangs in abdominal cavity. So you see, suspending the colon, right? And if the transverse colon is suspended by the mesentery, is called as mesocolon. You see, this is the cross section. I'll show you. This one is the mesentery. See, this one is the mesentery. All of these are mesentery, right? So because this is transverse colon, it is called as mesocolon, transverse mesocolon. Okay. Coming to the another fold, omenta. These are peritoneal folds that connect the stomach with other viscera. Okay. Okay. So if there is any folds, okay, stomach has many fold. Okay. So these are omenta. This is lesser omentum and this is greater omentum. At greater omentum, a fold connecting stomach with the transverse colon. Lesser omentum, fold connecting stomach with the liver. Gastrosplenic omentum, a fold connecting stomach with the spleen. Right? I'll show you. Just wait. So you see, we'll remove the parietal peritoneum. Right? We'll remove the visceral peritoneum, right? So this fatty layer you are seeing, okay, selected structure is called as greater omentum, right? This is greater omentum, which is lying in front of stomach, right? In stomach and in front of colon. You see all the intestine, you can see. Okay, so that is greater omentum. And if you see, this one is greater omentum. I will hide this. You see. You see, the selected structure is lesser omentum. Lesser omentum is going from stomach to the liver, under surface of the liver, right? That is liver. So See, this is greater omentum, and this one is gastrocolic ligament. Okay, from stomach to the colon, right? Transverse mesocolon, the part of greater omentum only, right? I'll hide that. I'll hide this. It's not here. So from stomach to the liver, this is liver. Okay, lesser omentum. This large hanging down is greater omentum, right? This is hanging down in front of intestines, right? In front of colon, small intestine, and large intestine with a free border. Okay, remember all these things. Okay, that's it. Greater omentum, lesser omentum. Okay, you see, this is the greater omentum, right? So the colon is behind this greater omentum, right? These are the colon, tinea coli. So the greater omental part, which is reflecting on transverse colon, is gastrocolic ligament, right? Okay. You see, this is the lesser omentum, okay, from stomach, lesser curvature of the stomach to the under surface of the liver, right? This is lesser omentum, and this one is greater omentum, right? Greater omentum and lesser omentum. This is the stomach, and this part is gastrocolic ligament, right? Coming to the ligaments, these are the folds that connect organs to the abdominal wall or to each other. So from organ to organ is called as omentum, right? From organ to the abdominal wall is called as ligament. Examples are gastrosplenic ligament, okay, between stomach and spleen. Lienorenal ligament between kidney and spleen. Coronary ligaments between liver and diaphragm. We'll see that. See, this is transverse mesocolon, right? So within this visceral peritoneum lies transverse colon, right? So the structure surrounding the transverse colon, okay, that is the transverse colon, is transverse mesocolon. Okay, this is greater omentum. You see, from behind the transverse colon is behind the greater omentum, right? So the greater omentum just hangs from stomach freely on all intestines. Okay, so you see, this is the lesser omentum. Okay, you'll see that with stomach also. You see, this is stomach, right? So this is stomach. So this is liver. So going from stomach to liver is lesser omentum, and this hanging down is greater omentum, and this one covering on the omental part on the colon is gastrocolic ligament, right? So that is spleen, right? That is spleen. Okay, we came. This is the view. We came to the left side posteriorly, right? And the thing is spleen. Okay, so the thing which connects spleen to the stomach. Okay, this one is stomach, right? So this one is spleen. So this one is gastrosplenic ligament, right? This one is gastrosplenic ligament, and this one is gastrophrenic ligament. Okay, that attached to the diaphragm. Okay, so this is coronary ligament. We will cover that. Okay, coronary ligaments. Right. That is between liver and diaphragm. You see, the selected structure is coronary ligament. Right. This one is between liver and diaphragm. Right. Liver attached to the diaphragm with the help of coronary. Right. You see, this is the greater momentum, right? So this is gastrocolic ligament. This is stomach, right? You see, coronary ligament, right? Attaching liver to the diaphragm. Okay, that is some intro to the peritoneum. Very basics of the peritoneum. We will cover every peritoneal part, okay, in the coming session. But in this session, you need to understand the embryology of the gastrointestinal tract. Okay, so I will show you. I will cover the just the cursory view of the gastrointestinal development. Okay, in embryo. Okay, so the developing gut is divided from above downwards into three parts, right? Foregut, midgut, and hindgut. So each part has its own artery. Foregut is supplied by celiac artery, and midgut is supplied by superior mesenteric artery, and hindgut supplied by inferior mesenteric artery, right? And the foregut gives to esophagus, stomach, upper half of duodenum. This is very important because the superior mesenteric artery, inferior mesenteric artery. So why this is important is the upper half of the duodenum, that is up to the opening of common bile duct, okay, is supplied by celiac artery, whereas the lower half of the duodenum, especially distal to the opening of common bile duct, is supplied by superior mesenteric artery, right? And also here you see from the midgut, right 2/3 of the transverse colon is supplied by superior mesenteric artery, whereas left 1/3 of the transverse colon is supplied by inferior mesenteric artery in the adult life. Because why? Because of the development within the embryo. Okay, so the midgut gives rise to lower half of duodenum, jejunum, ileum, ileojejunum, appendix, cecum, ascending colon, and right 2/3 of the transverse colon. Hindgut, descending colon, sigmoid, rectum, upper part of anal canal, right? So this is very easy. As you plunge into the abdominal organs, you'll remember all these things. Okay, see, this is the foregut, right? Up to this part is foregut, up to this part is midgut, and this one. So this one is applied by celiac artery, this one is applied by superior mesenteric artery. See, this one is applied by inferior mesenteric artery. Right. So this foregut is developed in as stomach and duodenum, esophagus, stomach and duodenum. This part, midgut, developed as intestines, and hindgut developed as colon and rectum and anal. The abdominal part of foregut possesses both ventral and dorsal mesogastrium mesenteries, right, which are termed as ventral mesogastrium and dorsal mesogastrium. The fate of ventral mesogastrium is ventral part forms the falciform and coronary ligaments. Okay. We'll see that. See, this is the embryo. This one is foregut, right? Midgut and hindgut, right? So if you see dorsal mesentery of gut, okay, this one. So this GI tract is fixed within the abdomen by two mesenteries, okay, this one, and in the foregut has two mesenteries, right, fixed to the abdomen by the help of these double peritoneal lines, right. So these are called as, this one is dorsal peritoneum, right, dorsal peritoneum, this one is ventral peritoneum. So these are very important things, right. So you see celiac artery, superior mesenteric artery and inferior mesenteric artery, okay, superior mesenteric artery, inferior mesenteric celiac artery, okay. So the observe, so this gut is stomodium, okay, that means oral, proctodium, that means anal, right. This is the caudal part, this is the cranial part. At first this is not like this, right, there is just a trigeminal layer, okay, trilaminar disc it is called, trilaminar disc, okay. So the disc becomes like this, folds ventrally, okay, because of the folding forms the caudal cranial part and caudal part, okay. There is no cranial and caudal part if this is like the disc, right. So because of the folding there forms the cranial part, that means oral part, head, and caudal part means tail, okay, head and tail. See, this is the trilaminar disc, right. So this is folding and invagination, all undergoes foldings, okay, invaginates ventrally, right. So because of the invagination, mesoderm forms around the gut and supplied by suspended by mesenteries, right, dorsal mesentery and ventral mesentery, okay. This is the foregut and this one is the midgut. Why? Because midgut has only dorsal mesogastrium, there is no ventral mesogastrium, whereas in the foregut there presents both dorsal mesogastrium and ventral mesogastrium. So you see the stomach, this is the very primitive stomach, right, very primitive stomach. This stomach and especially all the GIT is attached to the abdominal cavity by the mesogastriums, right, ventral and dorsal. Foregut has two gastriums, mesogastriums, right, ventral and dorsal, but midgut has only one mesogastrium, that is dorsal mesogastrium, right. So you see stomach is forming. When the stomach is forming, this is dorsal mesogastrium, this is ventral mesogastrium. So how stomach forms is stomach, this is the primitive stomach and this becomes elongated and it rotates on its axis, okay. It rotates on its own axis. So because of the rotation, okay, stomach is rotating like this, the clockwise. So what happens, stomach is Attached to the abdominal cavity, posterior abdominal cavity, abdominal wall, and anterior abdominal wall by mesogastriums, right? Mesenteries. This is the ventral mesogastrium, this is the dorsal mesogastrium. So the ventral mesogastriums comes like this and dorsal mesogastrium comes like this, right? So within the ventral mesogastrium develops liver, and within the dorsal mesogastrium develops spleen, right? So the liver becomes enlarged and comes to the right side. Stomach completely rotates on its axis. Okay, rotates on its axis, and the lesser curvature becomes the right side, and the greater curvature comes to the left side. And the spleen also comes to the left side, right? I'll show you. So this is the longitudinal axis. It is right. So it is rotating, rotating, rotating. Okay. So especially liver forms at this region, but because of the stomach rotation, liver comes all the way to here, right? So what happens, because the liver comes here, the space, okay, peritoneal cavity between stomach and liver is compressed like this. Okay, at first the peritoneal cavity is all here, but gradually peritoneal cavity right to this level only. It is called as lesser omen, lesser sac, okay, or omental bursa. We'll see that later. That is the development of stomach. Stomach elongated, prolonged, and rotates on its own axis, right? Rotates on its own axis and becomes left and right, right? Lesser curvature and greater curvature. See, this is the stomach, foregut, and midgut has intestinal loops, and this is hindgut. Okay, these are the intestinal loops. See, this is the midgut, right? This is superior mesenteric artery. So the midgut has superior mesenteric artery. Yeah. I'll explain. Okay. So this is the very primitive age, right? So what happens at this primitive age is this abdominal aorta. This one is abdominal aorta. This may not be abdominal aorta. Okay. This one is abdominal aorta, right? So at first, the midgut is supplied by very numerous vitelline arteries. Okay, vitelline arteries. After the differentiation of foregut and midgut and hindgut, these vitelline arteries obliterate, okay, and the abdominal aorta gives rise to the celiac artery, superior mesenteric artery, and inferior mesenteric artery, right? So if you observe, so these loops has superior mesenteric artery, right? Okay, so the part which is before the superior mesenteric artery or artery is called as prearterial segment of the gut, and the part which is caudal to the artery is post-arterial segment. Okay, within this midgut forms a cecal bud which becomes cecum. Okay, cecum, that means large intestine, and appendix. We will see that. You see, this is very This is very primitive, okay, very early. You see the whole, this is the yolk sac, and this is vital vein artery, right? Dorsal aorta, vital vein artery. As the embryo ages, the yolk sac becomes obliterated. Okay, it becomes less in size. So the loop, this intestinal loops becomes tubular, right? Tubular. Because of the growing stomach and peritoneal cavity, it intestinal loop becomes herniated through umbilicus, right? You see, this is the abdominal wall. It herniated through abdominal at the age of 3rd week up to the age of 10th week, right? Up to the age of 10th week, intestines becomes herniated and lies outside the abdominal cavity, and here outside the abdominal cavity they become more loops, okay, up to 6 meters, right, in the adult. Is ileojejunal, okay. This is the sacral bud, right? This is ileum. You see sacral bud becoming cecum, okay, and appendix. You see, this is artery. This one is pre-arterial segment and this one is post-arterial segment. What happens is when it herniated, the pre-arterial segment becomes anti-clockwise, okay. First, and 90% rotation, 90-degree rotation anti-clockwise, okay. So by that it becomes sagittal, right? After that it again rotates 90 degrees anti-clockwise. Again it rotates 90 degrees anti-clockwise, okay. So by that it becomes horizontal, okay. At first it lies as a sagittal, okay. That means in an anterior or posterior aspect. After that it rotates 90 degrees anti-clockwise and lies as horizontal, right? And then it forms many loops, okay, ileojejunum. And what happens then is at the 10th week it become regressed into the abdomen again, okay. So by that, while retracting into the abdomen, it again rotates anti-clockwise, right? It again rotates anti-clockwise, okay. But now what happens is, this is we have said this is pre-arterial segment and this is post-arterial segment, right? All this happens to the pre-arterial segment only, okay, because the post-arterial segment becomes large intestine, okay, cecum, colon, all these things. Pre-arterial segment becomes ileum and jejunum, right? So at the first, this is pre-arterial and post-arterial segment, but after the first rotation, what happens is the prearterial segment is right to the artery, whereas the postarterial segment is left to the artery, okay. So because they lie horizontal position, right? But after the third, okay, this is whole of a 270 degrees anti-clockwise rotation, right? After the completion of 270 degrees, what happens is this ileojejunum lies behind the superior mesenteric artery, okay. They lie behind the superior mesenteric artery, and at the same time this colon, colon lies in front of the superior mesenteric artery. So this is how intestines rotate. You see, this is the prearterial segment, postarterial segment, okay. This is the first part, and parietal segment becomes 90 degrees. Okay, 90 degrees, and again 90 degrees. Okay, and again this is behind. Okay, this is also 90 degrees. And this is the cloaca part. I will show you. Okay, this part, okay, this part is called hindgut. Okay, this one is cloaca. Okay, cloaca, it subdivides, okay, into two parts and becomes primitive rectum and anal canal, urogenital sinus. So remember this stomach, how the primitive gut hangs by the help of mesentery, right? Both dorsal mesogastrium and ventral mesogastrium. Within the ventral mesogastrium appears the liver, which grows so large. At the same time, intestines also grows very fast. Because there is no space, intestinal loops herniate through umbilicus. It is called as physiological herniation, right? So, so these are the, so this is the liver here, liver. Okay. So after you learn the embryological development, it will become very easy, right? Okay. Let me know if you have any doubts. Okay. Let me know.